Hello, and welcome to the final SLE project that I'm doing. My name is Shulman. I'm in the Academy for Healthcare Sciences, and my SLE was at the Morrisman Manning Emergency Medical Services, where I volunteered as an EMT. My mentor was Larry Gross. He's my captain, and up in the top right, you can see a picture of me and my partner Hunter after a 911 call in our full Tyvek suits, which we've been wearing since the coronavirus pandemic has started. So, a quick summary of what I did at Morrison. We transport patients to hospitals, usually Morristown Medical Center. There's a few others that we do by request. I'm also responsible for patient care as the lead EMT on my calls. I'm responsible for assessing my patients and then determining whether I need some kind of higher medical authority like a paramedic or whether I can transport them safely with just the crew that we have available. I'm also responsible for determining whether we need any additional resources like fire, police, or animal control to respond. And lastly, I'm responsible for communicating with medical professionals in an effort to make sure that no patient is ever abandoned. We have to transfer care whenever we get a patient to the hospital, and that is my job. I have had to learn how to properly, dictate medical histories and patient situations to other healthcare professionals in a concise and professional manner. So the first CTE standard that I found related to my SLE experience was CRP4, which is written out there. I was able to demonstrate the skills of communicating effectively by communicating with my partner on always determining what the best course of action for a call was or what the best course of action for a patient was. Communicating with my patients and explaining to them our plans and getting their story from them, and then communicating with doctors, nurses, and other medical professionals in an effort to transfer care and make sure that my patient is always fully understood and the story is understood. As an EMS professional, as an EMS provider, we have the luxury of seeing where the patient came from that the doctors and nurses might not have, and that our job is to relay that information. I was able to build upon these skills by developing my own means of communicating and my own strategies. Everybody communicates differently, and I have found certain ways with certain different types of people to get the information across in the best way. I also had to learn the standard kind of jargon and standard practice that we use in the hospital. One area that I still need to grow is, of course, patient communication and maintaining professionalism. There's always room to grow as far as communicating in the most effective and concise way, and professionalism is something that I hope to work on. It's something that I have definitely improved on, but there is definitely room to grow even more. My next CTE standard is CRP6, which is written there. I was able to demonstrate these skills through navigating my way through unique patient interactions. There's only so many situations and so many types of calls that you can go over in an EMT class or in training, and I was able to go through that during the summer. However, every call is different, no call is the same, and every single time you run into a sticky situation, whether it be legal or moral, ethical, anything like that, you have to find your way around it creatively. Also, with patient movement, if somebody, let's say, falls between a bed and a wall, sometimes it's very difficult to move them. You need to be able to creatively kind of think of a way to get them out of that situation without injuring them further. I was able to build upon these skills by learning how to make quick decisions, kind of think on my feet, and to consider every aspect of the decisions that I'm making. It's important to not just look at the wanted effect, but also look at any sort of effect that might happen that you don't expect, like a side effect. And one thing that I can always improve on is always learn to be ready, always be on my toes. Working in EMS has definitely made me a much more reactive person, and there's always room to grow there. My last CTE standard is CRP 12, which is written out there, and it focuses on teamwork and global competence. This is something that I extremely value. I have definitely gained an appreciation and a knowledge for culture that's different from my own while working in EMS. Um, One way that I was able to demonstrate my skills that I've learned here is to evaluate situations from every perspective and consider every viewpoint, which is something that most people definitely struggle with. I know I definitely struggled with before I joined, before I started doing EMS, but it's something that I definitely see as a strength of mine now. I was able to build upon these skills by gaining knowledge and appreciation for other cultural norms and researching what other cultures did. For example, there's certain gender-specific things that go along with the Jewish religion that I had to develop because there's a large Jewish population in the area that my squad covers. And something that I continue to work on to this day. And one thing that I can still grow, or one area that I can still grow in, is definitely to continue researching and growing my knowledge of other, traditions and cultures and people. No two groups of people are the same, and everyone's got their own unique things. It's important to be able to recognize those and be respectful of them. So my first CRP is 9.3.HL.5, which is written out there. Um, I've shown growth in relation to this by witnessing firsthand the implications of healthcare actions, whether it be people who are on hospice or decisions that I make. I see firsthand the legal and ethical repercussions of every medical decision that is made for somebody or recommended to somebody. Specifically, I have learned the consequences of the decisions that I make for my patients. So, whenever we have a patient that needs a certain type of treatment, it's important to understand the consequences that go along with that treatment and to be able to explain it. I also always consider the repercussions and ripple effects of everything that I do and everything that I recommend, and that's something that I'll definitely take away with me to any post-secondary education or a future career in medicine. Lastly, where do I still need to grow? I really want to gain an understanding of the ripples of every decision that I can potentially make, whether it be in healthcare or just in life. Every decision has infinite ripples, and it's important to understand the major ones in every situation that you recommend. My next CRP is written out there. It relates to clean and healthy, practice and reducing contaminants and pathogens, which is extraordinarily important right now during our coronavirus pandemic. So I definitely showed skills related to understanding sterilization practices and cleaning practices. On the ambulance, we have a UV light. We have various different types of personal protective equipment. We have various types of wipes and levels of wipes and things that we need to learn and understand it in order to keep ourselves safe and protect our patients. It gave me transferable skills that I've been able to use at home and on the job, and something that I'll definitely take with me to my field is an internal appreciation for the sterile field. In any kind of medical specialty, the sterile field is something that is very important and needs to be understood and appreciated and needs to be kept clean. And one thing I can still work on is continue learning about the procedures that we use to clean and sterilize things. My last CRP is in relation to communication strategies. I develop strategies of communicating, as I mentioned prior, with every type of patient and different types of communities. I found ways to better answer questions and be able to comfortably answer questions. I'll definitely take with me the ability to explain plans and goals to my future career. And one thing I can still work on is developing ways to make sure my patients receive information in the most clear way without any confusing language. So some takeaways is that I've developed understanding of what I want my future career to be. I'm hoping to get into a career in some kind of surgical specialty. Responsibility, being responsible for patients at the ripe old age of 17 is definitely something unique and something that I took away here. And leadership, as somebody who led fire and other EMS and police on these calls, I had to grow an appreciation and a understanding of how to lead people safely and responsibly. And some advice to rising seniors is be inquisitive, ask questions, create opportunities for yourself where they might not be, and to always think ahead and try to figure out ways that you can improve yourself. Thank you for listening.